Hello everybody. So a bit later today, let me just go on Instagram as well. Bear with me, and we're going to go live on Instagram. So again, Facebook, Instagram, we'll just give it a few minutes and see if people want to join us. Today's topic of discussion is a little bit about bone grafting. Turn that down a little bit about bone grafting, just an introduction. And my dear friends at BioHorizons have sent me a load of stuff that I'm going to talk you through. But you know, there's numerous other companies that do biomaterials, not just the company I work closely with. So I'll be going through that with you all today. So give it a couple of minutes. If you want to get any questions in, fire away. Instagram and Facebook. We're well into lockdown. It's still ongoing. We're still not able to be back at our dental practices. My hair is still out of control. I had a discussion with my wife this morning about taking the clippers to it, and she kindly volunteered, but I couldn't do it. So we'll just wait and see how crazy it gets over the next few weeks. And hopefully my hairdresser will be back working really soon, and he can fit me in and he can give this a good old chop, hopefully. So today's discussion is a bit about bone grafting, just an introduction, and I'll just give it another couple of minutes and then we'll make a start. And like I said, I've got a load of stuff here that I will be opening up and just talking you through what's in the box and kind of the indications where I would use it. You know, everybody has different opinions on bone grafting materials, so I'm just going to let you know what my opinion is and the products that I use because I feel they work in my hands. So that's the plan of attack over the next, hopefully 15-20 minutes. We're just going to go over a bone grafting. Hello to Ahad, Jamil, Anas, Nadeem. Great to see everybody on. If you have questions, please pop them in the comments. I'm happy to take questions. We're going to be talking about bone grafting material. And so just another minute and then I'll make a start. Let me know, how's your day been? Good day, great day, excellent day? Let me know, please. It's Ramadan, so I think day 11 of fasting. I'm just going to pop that off, and it's going okay actually, it's not too bad. I usually get up about 10:30, 11 because I go to sleep quite late, so I get up and then 10:30, 11 and then carry out my day and then go to sleep about 2 o'clock in the morning. So, and that seems to work quite well. Okay, I think we'll make a start to this. Good, so a bit about bone grafting, and what I want to cover is what's a bone graft, where you'd use it, and just go through some products that BioHorizons have kindly sent me for me to open and just let you see them and talk through exactly what's in the boxes and what indications I would use that particular material. When it comes to bone grafting, I suppose there's 4 different types of bone graft that we use as implant dentists or clinicians. We use autogenous bone, we use allograft, we use Xenograft, and we use alloplastic materials. So first starting with autogenous, which is classed as the gold standard. That's bone from the patient's own body from a different site. So it can be within the jaw or it can be an external site. And certainly historically, we used to take bone commonly from the hips, so from the iliac crest, but more and more we either take it from the surgical site or we go to a secondary site. And common secondary sites would be either the angle of the mandible, so the external oblique ridge, sometimes up towards the tuberosity, or the anterior mandible. So that's autogenous bone, and certainly it's classed the gold standard. Then there's allograft, and that's bone from another human. So allograft is a bone from another human. That's my go-to material that I use a lot of and works really well in my hands. And then there's Xenograft, and that's bone from another species, so animal bone. So it can either be horse, pig, cow bone, so that's Xenograft. And then the last one's alloplastic, and that refers to synthetic materials, which are popular. They're growing in popularity, and for either ethical reasons, a lot of patients like to choose that. Okay, so they're the 4 types. Autogenous, it's important that we know the terms and what they mean. Autogenous, when we're speaking to patients, even if you're a dentist not doing implants, not involved in bone grafting, I think it's important that you know the terms, because you'll get correspondence from clinicians about bone grafting that's been carried out, and patients will ask. And it's also important in terms of blood donation, bone grafting, and the type of bone graft used from a blood donation point of view, and I'll comment on that. So autogenous bone, let me just recover, is a patient's own bone from either the site of surgery or from a secondary site. There's allograft bone, that's from another human, so that's allograft. The xenograft is from another species, so either pig, horse or cow bone commonly, and then there's alloplastic, which is synthetic. So it's really important to know those terms. There's the common bone materials that we use. And what we're doing with bone materials and bone graft materials is we're replacing or we're building up the existing bone that the patient has. So we're either replacing or just building up the existing bone. So when it comes to bone grafting, there's 3 really, really important terms that relate to autogenous, allograft, xenograft, alloplastic. 3 really, really important terms that I'm going to cover. The first one is osseo-induction. So osseo-induction. And then I'll refer to the 4 different graft materials and where osseo-induction comes in, where osseo-conduction comes in, and also where osteogenesis comes in. So osseo-induction is when we induce differentiation of stem cells into osteogenic cells. So we induce differentiation of stem cells into osteogenic cells. So it's really important. So that's osseo-induction. Then we get osseo-conduction, and that's which we're providing just a network or a framework for new bone to form. So that's osseo-conductive. And then we have osteogenesis, and that's when we provide stem cells with osteogenic potential, which directly lays down new bone. So they're the 3 terms. So osseo-induction, osseo-conduction, and osteogenesis. And the different types of bone graft material that we offer our patients have different qualities. So back to autogenous, which is the gold standard, it is osteogenic, it's osseo-inductive, and it's also osteoconductive. Now that is the only material that is all 3, and that's why it's accepted as the gold standard. So autogenous bone is osteogenic, osseo-inductive, and osteoconductive. Then we've got allograft. So allograft from another human source, that is only osseo-inductive and osseo-conductive. It is not osteogenic. So it only has 2 of the 3 ideal properties that we need for bone. Then there's xenograft, and that is only osseo-conductive. A xenograft, which is from another species, only provides a framework for then blood to come in and recreate and make bone. So that's xenograft. And then there's alloplastic bone, and that is also only osseo-conductive. So that's the 4 different types of autogenous, allograft, xenograft, alloplast, and those 3 terms that are really important when we talk about bone materials and why we use a particular bone material. Osteogenic capacity of a bone graft material, osseo-inductive capacity, osseo-conductive. Now, I've got a load of stuff here that BioHorizons have kindly sent me, and I'm going to open them up, see what's inside, let you see what's inside the box, and then talk you through what clinical scenario I would potentially use this product. Now, I'm not paid by BioHorizons to show you these. There's many other great manufacturers. A lot of companies make different types of biomaterials, but they've kindly sent me these for me to show you. So the first one, and the material I use most commonly, is Mineros corticocancellus. So it's a mixture between corticocancellus chips, and this is allograft. This is an allograft material, so it's human. And I will commonly use this for GBR and mixed in with some autogenous. So I always like to add in autogenous to a lot of the bone grafting material I do. So I'll use it commonly for GBR, I'll mix in some autogenous, I maybe even use it for some ridge preservation, and it works really, really well in my hands. This works really, really well. And often if I was to place this into a socket and the patient wasn't keen on an implant in the next 6 months or so, I'd place this in. And if I was to go in, say, 9 months, 12 months, you don't see the graft particles at all. It's bone, it's bleeding, and it looks really, really good. And drilling through it, it feels like bone. So that's the first one. Then I've got, and these ones I can open because they're actually past their expiry date, so I'll certainly let some of you see what's inside the box. So this one is porcine anorganic bone material, so it's a Xenograft material. So it comes in a packet like this, and you can open it as granules. Now, I don't use a lot of Xenograft in my clinical practice, I'll be honest with you. The only times I really use it is if I had a patient and I took out a tooth and they said to me, I've no intention of getting an implant, not for the next year at least. Then potentially I would place in some Xenograft into that socket just to preserve the ridge, to reduce the amount of bony change that would happen after the tooth's removed. In that situation. The other situation where I would use Xenograft, if I'm doing a lateral sinus lift, I will often mix 50-50, so 50% Xenograft with 50% autogenous, and that would be for a lateral sinus graft. So the only two real indications that I use as Xenograft material. So it comes in a sterile pouch which I've opened, and it comes in a nice container, and it's just granules, yeah, it's like that, just sort of small granules. And it's not hydrated, so you can either mix it with blood, you can use sterile saline, or you can use PRF. So that's porcine. It's a Xenograft material, and you can get various particle sizes. So commonly I would use a smaller particles. I really use large ones. So that's the Xenograft. Right, what else have I got here? I've got another box here, and this is, so that the last one was porcine, pig. This is bovine, so much the same. Let's say, and I'll just let you see that. I'll open this one as well, might as well. Okay, so again, you can see sterile pouch, and often it comes with these sticky labels that you put into the patient's notes. So each one's individually coded, and it's got a lot and a reference number, and you need to put them into the patient's notes. So what would happen is, what's inside here is sterile. So you would get your assistant, when you're draped up or whatever, or before, your assistant would then open it up and drop it onto the surgical field from a high up position like this, and let it drop on. And then this part is sterile, and then obviously the contents are sterile. Okay, and then we'll just open that up. Okay, and there's the contents, and again it's just a granular material. So just white granules. Good. Let's see what else they've sent me here. I've got some bone graft with collagen. So let me see what this is like, because I've not used this before. Okay, so it's like a cube. So this comes as a cube, and actually I've never used this product before. But once this is hydrated, it just makes it so much easier to pack into a socket. I know Geislake do a similar product, Bios Collagen. So I think this is the equivalent from BioHorizons. So it's a cube. Once it's hydrated, you can put it into sort of a metal cup, hydrate it with either blood or saline, and then you can pick it up with your tissue forceps, pop it into the socket, and it's much more easier to handle rather than granules, which, unless you use PRF to help clump it together, then it can start going everywhere, and sometimes you end up dropping it, and it goes into the back of the patient's throat, etc. So this is a bone graft with collagen. Okay, so I'll open this. So you can see it came in one packet, and then actually there's another sterile pouch, and that's what you can then drop onto the sterile field. And if you open that, it's really just like a small cube. I'll let you see that. And once that's hydrated, then it's much more easy to sort of pack into a socket. It's much more malleable. So that's the bone graft material with collagen. And Geislick do a product like that, and I didn't know BioHorizons did one. There you go, learn something new every day. Right, what else have I got? I've got some, they've also sent me some of these Bioplugs. I'll just show you this, I'll open it up. So these are not out of date, but I'm sure they won't mind me opening this up. Okay, so this is a Bioplug. So, you know, within practice, a lot of us will commonly use hemocollagen plugs. I certainly like to use them a lot to help contain the clot, the blood clot, because that's ideal to try to stop us getting a dry socket or a localized osteitis. So it's something like this. So it's very easy. It just fits into the extraction socket, especially for interiors. It soaks up the blood and becomes like gelatin-like, and then you can either put some sutures over it, or you can just leave it, but it's squishy. You see, yeah. So it's just like those hemocollagen plugs. Yeah. So it really helps maintain that blood clot. So that's the hemocollagen. This is called the Bioplugs. Okay, we've got just another box of bone graft material. I won't open that. I've got some membrane here, which I'm going to open. Okay, so often when we do bone graft material, we cover it up with a membrane just to protect the graft material, soft tissue ingress, and it certainly helps contain the graft. And there's various ways to secure the membrane, but I won't go into that. But so this is some Memlock, and again, different companies call it different things, but it's conventionally called like a membrane. So that's square. So inside is the sterile pouch, and that's little square, and you cut that to size, and it fits over. And really, you know, what's so important about grafting is a couple of things. You need space, so you need a space for a graft material to be contained, and it needs to be stable. And what a membrane allows you to do is stabilize the graft to a degree. So two important things with grafting: it needs to be, you need to have space for a graft, and it needs to be stable. That's critical for success in your grafting. And the other thing is, you know, you want tension-free closure. So, but the two main things is space and stability when we're grafting. And then I've got my last little box here, and it's a different type of membrane. So this is a cytoplast membrane, and it's slightly different. And again, this is out of date, so I'm going to open it. I'm going to let you see exactly what's in this box. Okay. And it's always well packaged. So it comes in like this. And again, it's got stickers and details that you put into the patient's notes. And this is it. Can you see it inside? And you can see the metal cross. And I just want to open that and let you see exactly what it is. So again, pouch, drop it onto the surgical field. And this is it. So it's like this. So this is a membrane that's not resorbable. What I should have said about this membrane I showed you is resorbable. So the body just, you know, it disappears after a period of time, and the Memlock roughly takes anywhere in the region of 4 to 6 months potentially. So it's a long-lasting membrane. But this needs to be, once you put this in to a patient, you need to remove this. It needs to be taken out, so a secondary surgery. And it's got titanium reinforcement, and that's to help it keep its shape. And membranes like this come in different sizes and shapes. And again, this is so important for, you know, achieving stability for your graft. And what you can do is this will help maintain stability of a graft better than a membrane that's non-rigid. And this has a lot more rigidity to it. And so this is a cytoplast, okay? And it comes in various sizes, shapes, and it's tie reinforced. Okay, that's that. Okay, good. I think I've gone through all the things I wanted to here. Just to recap, bone graft materials autogenous. Remember, that's patient's own. Allograft material xenograft material and alloplast material. It's so important to know those terms, and then also to know the terms osteogenic potential of what material is what. Is it osteoinductive? Is it osteoconductive? But I can tell you, autogenous bone is all three. Is osteogenic, is osteoinductive, is osteoconductive. Great. So I just want to say I am on Instagram and Facebook here. I will download this video to my YouTube channel afterwards, and so you can recap it on my YouTube channel, and I'll post up a link. And also just to let you know that I'm doing a Zoom teaching session on Thursday and Monday for dentists looking to get into implants, just top tips and tricks, and also I will be going through how to assess a patient with an edentulous space. And I think as dental clinicians, it's something that we should all be really skilled at, so we know what we're looking for and different options that we should be discussing with our patient, some of the pros and cons between the different options, and how to assess a gap from an implant point of view. So we'll be covering quite a lot. So Thursday's Zoom teaching session is full. It's that capacity, and I've then put on another one on Monday. If you'd like to be a part of that, then please pop your email address on the comment box below, and I'll add you to the list, and then I'll send you a link for that Zoom meeting. So any question? Thanks to Heed. Heed's just mentioned that there's a good document on the BioHorizons website outlining indications for each material. Yeah, absolutely. There's a wealth of information on all these websites, and if you go to whichever particular manufacturer or industry partner you like working with, they'll give you a wealth of information. But I suppose one thing I would say is probably most important is try different products out and see what works in your hands, and then touch base with other colleagues. I think that's really important. Ask them what product they use and why they use a particular product. For me, it's simple. My go-to product is Allograft. It works really well in my hands. I get good results with it, so why would I change? Okay, any questions? If not, I'm going to go and leave you be. Take care. Thanks for everybody tuning in. Be safe, and I'll probably be back tomorrow to give you something else, which I've not yet decided what I'll be covering.